We're joined today by members of our administration as well as medical professionals who played integral roles in the design and development of the guidelines for schools to safely reopen in the fall. In developing the back-to-school plans, the department and our administration considered not only the risks associated with COVID-19 for in-person schooling, but also the risks associated with continuing to keep students out of the classroom. Continued isolation poses very real risks to our kids' mental and physical health and to their educational development. This plan will allow schools to responsibly do what is best for students, which is to bring them back to school to learn and grow. The detailed document released today was developed with extensive conversations with medical experts, school administrators, and other education stakeholders. Commissioner Jeff Riley and his team worked with infectious disease physicians, pediatricians, and the COVID-19 Command Center's Medical Advisory Board to develop these plans. And thanks to that work, the Massachusetts chapter of the American Academy of Pediatrics supports this carefully developed guidance to bring kids back this fall. School officials now have a blueprint that they can use to create plans using 3 models of learning with a priority on providing in-person instruction. Again, the goal is to get kids back to the classroom, but we're advising districts to develop additional plans. These plans could be implemented if COVID-19 conditions change and districts need to adjust their programs. Commissioner Riley will discuss the 3 plans' details shortly. Over the past several weeks, Massachusetts has seen rates of infection, hospitalizations, and fatalities fall steadily, even as the virus remains a significant concern. As we all know, COVID-19 in Massachusetts is not static, and we'll continue to monitor the situation closely to make any adjustments that we need to make. Part of the challenge in developing this guidance is that we're talking about a school year that starts a few months from now, and sometimes it's difficult to forecast where exactly we'll be when we get to September. This guidance assumes that health data continues to stabilize and the requirements are still subject to revision. But now districts can get to work on their preparations to be ready for the fall. We also understand that there are costs associated with implementing many of these recommendations, and that's why we're making available approximately $200 million in additional funding for district school costs related to reopening. This comes on top of the nearly $502 million that our administration made available to cities and towns to spend on COVID-related costs at the end of last month. Massachusetts cities and towns also received almost $200 million in federal elementary and secondary school emergency relief fund grants earlier this year. And additionally, in partnership with legislative leadership, our administration is committing $25 million in federal funds to a matching grant program to fund technology purchases for remote learning should it become necessary for school districts. With DESE's guidance and financial support worth just about $1 billion, school officials have the information and the resources that they'll need to implement the needed distance requirements, classroom configurations, mask and face covering requirements, and symptom checks to make this all happen. Parents and guardians have done their part, stepping up in extraordinary ways virtually overnight to become educators at during an enormously challenging time. Now we have an obligation to do everything that we can to get kids safely back into the classroom so that they can benefit from the guidance and the experience of their teachers, other leaders, and their peers. To sum it up, we really appreciate the work that so many people put in to helping us develop a plan to help kids safely return to the classroom in September. Secondly, this plan was developed with the support and assistance of many members of the infectious disease, healthcare, and physician community, and we're really pleased that the Mass chapter of the American Academy of Pediatrics endorsed it. And third, there's almost $1 billion in state and federal funding that's available to make sure that our districts have the resources that they need to implement this plan. And with that, I'm going to turn it over to the Lieutenant Governor.
Thank you, Governor Baker, and I wish to thank Secretary Pizer and Commissioner Riley and your teams for your hard work on behalf of our schools and the children of our Commonwealth. Getting kids back to school is good for kids, but it's also good for the entire family. Over these past few months, parents have worked hard to keep their children active, educated, and yes, entertained while balancing work and every other thing that parents juggle. This guidance will implement public health and safety requirements to ensure that as many students as possible head back to classrooms this fall. We know how very important it is for kids to be in school, not just for academics, but for their social development, emotional needs, and mental health needs. These rules take every precaution possible and are grounded in the best possible medical advice, which you will be hearing from shortly. Massachusetts consistently ranks in the highest in the nation in terms of education quality, and our administration is committed to continuing to provide our children with the high caliber of education and learning that they deserve. As a mother of 2 high school students, I understand how much of an impact this shift has had on our children's daily lives, from the classroom learning to after-school activities to team sports. Our students missed a lot this past spring, and it was hard for all of us to see them miss proms and graduations, activities that they so enjoyed, and even saying goodbye to their friends and teachers at the end of the school year. And as we began to reopen the Commonwealth this month, I think a lot of us have felt a sense of relief as we begin to transition into new activities. And with today's announcement to reopen schools in the fall, our goals remain getting as many students back as possible into classrooms, into seats, as safely as we can. This guidance gives school districts enough detailed information and flexibility to maximize the number of students they can bring back to classrooms. We understand this will be difficult for schools to make these changes, and we will continue to work with them to support them to implement these new regulations and guidance. Schools will look different in every community as they adapt to this new way of educating to best fit their specific needs and circumstances. We know we are not out of the woods yet in combating this virus, so we need to live with it. And we must continue to be cautious and vigilant in fighting this disease and protect ourselves, our families, and our neighbors. Everyone must continue to do their part. But going back to school has always felt like a new beginning. Getting our children back to school this fall is critical. It's critical to their continued development, both in and out of the classroom. And in order to facilitate a thriving workforce, we need to continue to equip our students with the skills and the education to prepare them to succeed in their future. And returning to classroom is an important step toward this goal. Our kids deserve it. They deserve the opportunity to grow and succeed here in our Commonwealth. I would now like to turn it over to Commissioner Riley.
Good afternoon, everyone. I want to start by thanking our students, teachers, and families for adapting this spring to this unprecedented situation. Today, DESE has sent out initial guidance to our schools and districts, asking them to be prepared for all contingencies for reopening this fall, which typically takes place around Labor Day. Additional fall guidance will be also released in July, so more is coming. This guidance today was built with the help of our medical community, some of whom are here today, our reopening work group made up of students, parents, teachers, nurses, administrators, and other important stakeholders in the education sector. Recognizing we do not have full control over the trajectory of the coronavirus, we've asked schools and districts to prepare for 3 possibilities or models. The first, which we're speaking about in detail today, is the in-person model. Students return to school in buildings, but schedules, classrooms, and protocols are adapted to meet health and safety requirements we prescribe in the guidance today. The second model is a hybrid model where some students would go back to school while another group would stay home and learn remotely, and then they'd switch. Whether that is week on, week off, or different days of the week is to be determined. And then the final thing we are asking districts to plan for is remote learning. In the case, for example, of a second spike of the virus. Simply put, our goal is to get as many students back to in-person learning with the appropriate health and safety requirements in place. This plan allows us to do that for the good of all of our kids. What we have learned from our medical experts is there is no one silver bullet that will help us mitigate risk. Instead, it is a combination of strategies like hand washing or sanitizer, physical distancing, and masks that, when taken together, will make the difference. The health and safety requirements contained within our guidance document are crucial, for they will allow districts and schools to begin planning for what safe in-person instruction could look like in the fall. Indeed, while we're asking for these 3 plans, we're asking in districts and schools to first prioritize developing the in-person plan with the new safety requirements. The department will closely monitor how this is progressing in the field, and we will offer technical support over the summer to help our schools and districts. And we know that this work will require resources, and that districts will have to plan for those additional resources. We know that, in particular, special attention needs to be paid to our historically underfunded school districts, and we are grateful to this administration for releasing new monies today for schools, including a matching grant for technology, even as we recognize the full budget picture is not yet clear. We will continue to update our guidance as the new information becomes available. This is especially true with the new medical research and studies that may come out over the summer and help us to better refine our expectations for what a safe in-person school experience will look like. And with that, it is my honor to turn it over to Dr. Sandra Nelson, an infectious disease specialist from MGH, and she's also on the faculty of the Harvard Medical School. Dr. Nelson.
Thank you, Governor Baker, Lieutenant Governor Polito, and Commissioner Riley. As an infectious diseases physician, I am proud that the nation's medical community shifted so quickly into emergency mode as the COVID epidemic surged before us. The impact of this previously unknown illness has been like nothing we have ever seen before. We also recognize, however, that shutting down so much of our society to fight the medical battle, while vital, has taken a significant toll on our communities, on our children, their education, and their well-being. Our medical advisory team was asked by Commissioner Riley to review our scientific understanding of COVID-19 in children in order to ensure that medical issues would be an essential driver in any decision about moving education back into the classroom. The message from the medical community remains strong and consistent. We need to get our children back to school as soon as it is safe to do so. While the state of our scientific understanding remains incomplete, we have learned an unprecedented amount in a short time. We believe that the medical literature does, in fact, provide the tenets for a safe return to school. First, children are less likely to acquire COVID than adults. We have seen in large population-based studies, as well as smaller household analyses, that children are less likely than adults to be diagnosed with COVID and less likely to get sick when exposed. Second, when children are infected with COVID, they are less likely to get severely ill than adults with COVID. And third, when children acquire COVID, they appear less likely to transmit infections to others relative to adults. This is in contrast to other respiratory virus infections such as influenza, in which children are the major drivers of infection. Modeling studies also suggest that school closures have had less impact on slowing the epidemic down than other distancing measures. With this understanding, and with a reduced incidence of COVID in our community, we do believe that it is safe for our children to return to in-person learning at school. But this does not mean that we can let our guard down, either in the schools or in our communities. Our educational leaders will be instituting measures in the schools to reduce the chance of spread, and these include physical distancing measures as well as the use of face coverings. The guidance set forth will also be reassessed, both as our state of knowledge about COVID increases and potentially as conditions on the ground change. Return to in-person learning can only be successful if we in the community do our part to keep the rates of transmission low. Now more than ever, protecting and educating our children requires a village. We must all remain vigilant. Our children depend on it, and they deserve nothing less. Now I'd like to introduce Dr. Lloyd Fisher, a pediatrician in Worcester and the incoming president of the Massachusetts chapter of the American Academy of Pediatrics.
Good afternoon. Thank you, Governor Baker, Lieutenant Governor Polito, and Commissioner Riley for having me here today and for including the pediatricians in this particularly important discussion and decision about how we can safely bring our children back to school this fall. The Massachusetts chapter of the American Academy of Pediatrics represents over 1,700 pediatricians across the Commonwealth who are committed to the attainment of optimal physical, mental, and social health for all infants, children, adolescents, and young adults. While for most children, COVID-19 has not had the devastating and life-threatening physical health effects that have occurred in adults, the negative impact on their education, mental health, and social development has been substantial. The school experience provides so much more than academic learning and the relationships that children form with their teachers, other school personnel, and their peers are critical to their emotional health and well-being. In my day-to-day interactions with children and their families over the past few months, it has become clear that for many, the remote learning experience has been a challenge. It is evident that these children value the virtual interaction that they have with their teachers and their classmates. However, we see how difficult it can be for parents who are trying to work either at home or out of the home, while trying to help their children sign into their Zoom meetings with their class and assist them with their schoolwork. We know that the teachers and the school administrators have worked tirelessly to make the best possible experience for many children, especially those in the younger grades. But nothing can take the place of the daily face-to-face interaction that our children experience when attending school in person. In addition, children with emotional, psychological, or developmental disabilities often receive necessary services through their schools. Because some of these services have been put on hold during the pandemic, continued school closures will be especially detrimental to this group of vulnerable children. We are also concerned with how school closures will likely exacerbate the well-documented achievement disparities across income levels and ethnic and racial groups. The Massachusetts chapter of the American Academy of Pediatrics and the Department of Elementary and Secondary Education share the goal of bringing most students in the Commonwealth back to in-person learning this fall, while minimizing the risk to them, the school staff, and their families. We are quite pleased with the recommendations and are happy to endorse these guidelines. We are impressed with how thorough the work group was in researching the current data and their understanding of the spread of illness, impact of the disease on children, likelihood of children infecting others, and the significant negative consequences that prolonged school closures have on the educational, emotional, and social well-being of children. We recognize that if there is a second wave this fall or winter, we may need to move to a hybrid model or back to full remote learning. These guidelines outline important steps that school districts must take to ensure that if that were to occur, students will continue to advance in their learning. We know that for many parents and children, there will be some hesitation and fear about resuming in-person learning. It is our belief that the mitigation efforts outlined in these guidelines appropriately take into consideration the many complexities of a return to school in the fall and outline the precautions necessary to maximize the benefit to our children while minimizing risk to both them and those whom with they interact. It is also critically important for our children to have a positive experience and feel comfortable with the modifications to this classroom, the curriculum, and their interaction with teachers and peers despite the necessary changes. The understanding and experience that we and those across the globe have with this virus continues to expand each day. I and other pediatricians throughout the Commonwealth look forward to our continued work with the department as new information becomes available that necessitates modifications to these guidelines. I know we all look forward to a time when we can relax some of the changes that our children will see this fall. And I am confident that together we can come up with an appropriate plan to make that happen when it makes sense. Thank you to the administration, the working group, and the members of the Department of Elementary and Secondary Education for developing a plan that we at the Massachusetts chapter of the American Academy of Pediatrics feel is in the best interests of the children in the Commonwealth. Thank you. I will now turn things over to Secretary Pizer.
Thank you, Dr. Fisher, and thank you so much for the engagement and support of the Academy in this important work. And good afternoon, everyone. My main task today is to introduce Raquel Quesada, a parent from Lawrence who has watched her children struggle without the opportunity to go to school each day. Raquel was a member of the Commissioner's K-12 Reopening Schools Working Group that provided input and feedback in today's initial guidance. Raquel is here to underline the importance of parents in this whole process, especially as schools and districts begin working on their own plans and thinking about all the many details that are necessary for implementation. Those details may be small in the context of a district-wide plan, but they can be extremely consequential for individual families and children. So it is critical that parents are fully involved. As we plan for going back to school this fall, we obviously have to make the health and safety of our students, staff, teachers, and communities a top priority. And we have to make sure that parents feel comfortable and confident that the well-being of their children will be our paramount concern. Of course, well-being is not just about COVID, as Dr. Fisher has just stated. The absence of school can cause and already has caused significant challenges for children and families, certainly related to learning loss, but also exacerbating issues of mental health, food insecurity, and social and emotional development. At the same time, when some students are not in school, they are in home or community environments that are not always as well monitored and safe as the school itself. So even their physical health can be put at risk by school closures. All of these challenges are especially acute for students with special needs, who desperately need access to the support services and the daily routines that only school and only in-person school can provide. I'd now like to turn the podium over to Raquel Quesada to provide her perspective on the importance of getting her children and all children safely back to school as soon as possible. Ms. Quesada.
Good afternoon to all the people who are accompanying us present through the screen and different platforms. To the Governor Charlie Baker, Commissioner Jeffrey Riley, to the all educator, school administrator, parents, and the community members, and to the press for being here covering such an important topic. Thank you for the important opportunity to allow me to speak on behalf of the parents. My name is Raquel Quesada, advocate for the rights of people with disability. I'm also the mother of 4 children, one with disability. I was a member of the K-12 Working Group, Academy Teaching Learning Subcommittee for the state. We have been working very hard, meeting twice a week to develop these guidelines. As a parent, I was there to make sure that the school official thought about their needs, concern, and fear of the parent when sending their children back to school. There was a voice in this working group to represent parents, and that was me. I feel very comfortable sending my children back to school with these current health and safety guidelines. My kids have been emotionally stressed by not being in school, and it has not been good for their health and for the entire family. My son with cerebral palsy, he's crying every day because he's very stressed out and because he needs his routine back that will provide his mental health, and I know a lot of parents are in the same situation that I am. Children need to get their life back, and parents too. They need to socialize with their peers by taking the necessary measures that are in the new guidelines for requirement to return to school. Parents should be comfortable with those new guidelines for starting school. I'm sure the principal, teacher, professional, and the staff of every school will put all those precautions in place. They will be sure that they are followed by everyone. Life is not about fear. We know that we have to take care of ourselves and our children too. But at the same time, we have to continue our life and living, adapting ourselves to the new normal. Thank you. Now I would like to speak on behalf of the Latino community in Spanish. Muy buenas tardes a todos los presentes. Muy buenas tardes a todas las personas que nos están acompañando, tanto presente como a través de la pantalla. Al gobernador Charlie Baker, al comisionador Jeffrey Riley y a todos los educadores, administradores escolares, padres y miembros de la comunidad. A la prensa por estar aquí cubriendo tan importante tópico. Gracias por tan importante oportunidad de permitirme dirigirme a los padres. Mi nombre es Raquel Quesada, abogadora de los derechos de las personas con discapacidades y también madre de 4 hijos, uno con discapacidad. Fui miembro del trabajo K-12 del Subcomité Académico de Enseñanza y Aprendizaje para el Estado de Massachusetts. Hemos estado trabajando muy duro, reuniéndonos 2 veces por semana para desarrollar esta guía. Como madre, estuve allí para asegurarme de que los funcionarios de las escuelas pensaran en las necesidades, dudas y temores de los padres al enviar a sus hijos de regreso a la escuela. Había una voz en este grupo de trabajo para representar a los padres y esa era yo. Me siento muy cómoda enviando a mis hijos de regreso a la escuela con estas pautas de salud y seguridad vigentes. Mis hijos han estado estresados emocionalmente, al igual que yo, por no estar en la escuela. He estado en riesgo de salud mental toda la familia. Mi hijo con parálisis cerebral ha desarrollado un nuevo comportamiento de llorar por nada y sé que él necesita apoyo de rutina que le proporciona una escuela para su desarrollo. Los niños necesitan recuperar sus vidas y los padres también. Ellos necesitan socializarse con sus compañeros, tomando las medidas necesarias que están en las nuevas guías de requerimiento para volver a la escuela. Los padres deben sentirse cómodos con estas nuevas pautas para empezar las escuelas. Los maestros podrán todas estas medidas en su lugar y estarán seguros de que se cumplan. La vida no se trata de miedo. Sabemos que tenemos que cuidarnos y cuidar a nuestros hijos, pero al mismo tiempo tenemos que seguir viviendo, adaptándonos al nuevo vivir. Muchas gracias.